Good afternoon, ladies and gentlemen. I welcome you to the next webinar of Screver and Cap2. This time we will be talking about the insights on omnichannel strategy and CX in pharma. Please note that we cannot see and we cannot hear you. The only way you can communicate with us is through the channel of chat and questions. And it would be very nice if you could give me a sign that you hear me. I can already see some thumbs up coming. So that's very good. We will wait for a few more minutes to see that everybody is in who is listening to us. Thank you very much. That's a lot of thumbs up. I understood we can be heard. It is very important that if you have any question, any text, do please write in the chat. We will react upon that. Do please formulate your questions in the question channel or straight in the chat. And at appropriate moments, we will ask our guest to answer your questions. We will also introduce several surveys while we are speaking. Our guest will trigger them, and you will be able to use your mobile phone and scan the QR code and answer the surveys on the go while we are talking and presenting this event. So that was the small and short technical introduction to our presentation today. And now I would really like to welcome our guest, Myszkowski, who is a many years standing and leading customer experience lead at MSD in the Middle European region. He has more than 25 years experience in CX in various international companies. He has worked in Europe, Asia. He travels across borders and languages. He understands differences in culture and understanding of problems from all sides. He is also a former Thai boxing fighter, a father of 3, and a dedicated sportsman. Myszkowski, the stage is yours.
Thank you very much. Yeah, the sport is nice, but the fighting days are over. Now I fight with CX, so let's get right into it. So thank you very much for the introduction. I see we have quite some audience today, which is very nice that people are willing to listen to me on such a hot day. In my office, I think there is 34 degrees today in Lucerne, Switzerland. So thanks for taking the time. Bear with me. I'll try to do it entertaining. I'll try to do it in a way where we can also interact. As Wojtek said, do write questions. We will stop often to answer them, and we will have a Q&A session at the end of the presentation. Today, it's all about Omnichannel and CX. And I think before we deep dive into examples and best practices, we will set the stage so that we all understand the same of what is Omnichannel, what is CX, and what is special in pharma. So let me start by introducing myself a bit on top of what Wojtek said. So yes, indeed, again, the sport part, but I think you are not here to watch me do sports, but to talk a bit about what is relevant to you as well in the pharma sector. Yes, I'm a father of 3, master of none. I do 25 years of trial and error in different industries. And I am currently the CX lead at MSD for a region of 30 plus countries. I have to say, of course, you all know, as we are in pharma, all opinions are my own. I'm not sharing any critical details. I'm not sharing anything that would need an NDA or similar. I'm sharing all my opinions and experiences so that hopefully you could leverage that as well in your companies for better patient outcomes. And let's start with actually setting our understanding. So what is omnichannel for you? I'll ask the moderators to set up the quick poll, which you see. So you could answer. Is it a communication through multiple channels? Is it orchestrated communication across channels? And you see you can only answer one. But I would be really curious to get a few clicks here, which will then trigger to set the base for our discussions. leave you a bit of time. As I see, so, all right. Good, I see we have already some answers. And obviously the number one is orchestrated communication across channels, but we also have some answers of communication through multiple channels. And of course, this was a trick question, because omnichannel means communicating through multiple channels, but in an orchestrated way. I think that is the clear distinguishing between multi-channel and omni-channel, right? So if we moved with our presentation, I ask you another question and then I reveal the wider context. So the second question to set the scene is, what is CX for you? Is it your or any marketing plan and segmentation strategy, or is it the impression the customer has of a company across all touch points? And I'll also let you answer and wait a bit for having some results. And don't worry, afterwards we deep dive into the details of it, and then we have some polls later on. But those are the two that set the scene at the moment. Good. Here we have a more clear outcome. So CX is the impression a company has, a customer has of a company across all touch points. And I'll deep dive right away into one of many definitions of what is CX. And I do not want to read out all slides, but I think here this one is important for us for setting the scene, that CX is the impression a customer has of a brand or a product or a person in a company based on all interactions before, during, and after purchase. So it's important that it's also about the humans, it's about the digital channels, it's about the physical products and the perception. So it's all across all touch points. So even touch points where we have nothing to do with, right? Like news, like social media. So all of this is customer experience. And I think this is also critical for us customer experience experts, because, and as you will see on the next slide, it encompasses every aspect of the HCP, healthcare professional experience across everything. So I would say in pharma, there is, in every industry, but specifically in pharma, we have a lot of concepts of complexity, a lot of additional elements which require attention when we define customer experience, when we define what we want to deliver to customers. And you can read them all on the slide, because as you know, we have multiple target audience, we have so much data, we have as well different solutions, we have different stages with market access, with drug development, with marketing, and real world evidence, right? So I think it is key for us to understand that we cannot look at it beyond looking at it from a full range of the customer experience, right? We cannot look at it in silos. We have to look at it in omnichannel, right? Which we learned is the orchestrated way of communicating to our customer. And I think I speak from the heart as well to the others. We, of course, have as well our daily work, right? We have our compliance, we have our creative work, we have our corporate meetings and so on, while we also want to innovate towards customer experience, right? So that means we CX experts, we that take care of it, we are, and I introduce you here, the famous animal which lives in the mountains of Switzerland, which is called the eierlegende Wollmilchsau, which is an existing animal, is very rare. You have to, basically lie in the Alps days and nights with your goggles to find them. And of course, it can do everything, right? It is a sheep for the wool. It is a chicken for the eggs. It is a cow for the milks. and it is a port for the meat, and so on, right? So it can do everything, and this is also expected from us, right? We must know the customer, we must know the touch points, we must know our company, we must know all technologies, and we must know the wider ecosystem and business challenges, right? So not an easy task to do, but we are able to master it, of course. Now let me start by, we set the scene, we know what is kind of omnichannel, we know the wide fields of CX. Now, how do we tackle all this? How do we split it in pieces, approach it so that we can deliver something of value to the customer? And I'm assuming that most of us are working in the marketing field. So we are not part of producing the drug, right? We are part of commercializing the drug. And hence we are in the business of information. So here we have to know our customer, and to know our customer, and we will share all those slides so you can Google much more resources about the concept of jobs to be done, which is basically understanding those aspects which you see on the screen, what is functional, what is emotional, but also in terms of the personal dimension of it. So I'll just give you a quick example. There's often a reference to the milkshake example and the Ford example, but today I'll pick the Spotify example. So you might be familiar, Spotify is the music platform, right? And initially, when you asked maybe in the 60s or 70s somebody about music and listening to music, they would say, I like to own an LP, I like to own a cassette, I like to own a CD. But is that really the job they wanted to have done, completed? No, probably the job to be completed is listening to their favorite musician, right? So this is what Spotify solves, because you don't own the music, right? You pay a monthly fee. In return, you can listen to a variety of music. So hence, the real job to be done is listening to my favorite musician. And maybe also another job might be, I want to learn new music. So in the past, you went to the CD store, LP store, whatever, however old you are, and you could listen some you could not listen, and then you bought it. Then there was MTV where you heard some music. Then, of course, there was forever there is and was radio. But now you can basically go on Spotify. You have a freemium model with commercials and a paid model where you are not interrupted, and then you can listen to your music. So I think that is key, that you go beyond the obvious. The HCP, the doctor, the nurse, the surgeon, they most likely don't want to receive an email. They do want to be updated about products, and there is a vast majority, depending on therapeutic area, so that you are, as a HCP, reliant on pharma to actually get you this information in a snackable way through digital or personal means. So again, the job to be done for a HCP, which we can fulfill, is the information, insights, study data, and so on, right? The proof that what she or he will prescribe or hand over to the patients is of value to the patients. And also, so this is one, right? We have to know the customer a bit beyond the obvious, a bit beyond the tactics. Second is, we have to define some kind of a value chain. And obviously here, while I cannot share the details of how we did it at MSD, I'm sure that all of you in other pharmas do it in a structurally similar way. So you certainly start somewhere with a strategic opportunity, a business opportunity. I want to launch a drug, I want to increase my market share, whatever opportunity, challenge, or business goal you have. And then at the other end, you want to have the business value of it, right? The increased sales, the increased business impacts. And then in the middle, if we go step by step, you first have things which I think all, and in other industries even more, are well in measuring, which is the customer engagement. How many clicks, how many people downloaded something, how many emails did we send, how many times the sales person visited a target HCP, and so on. The second one, which we'll deep dive in a second, is customer value, right? How do we measure that? I parked up for a second. And how do we translate this customer value into business value? Like if somebody downloaded three 3 brochures, did that result in more sales? Did that result in value at all for them? Did they like what they see, and so on? So let's deep dive into that a bit later. So now we know kind of how to approach it, understanding the customer. We know we need some kind of a flow, some kind of a splitting our huge problem into small pieces, and referring to numbers, which I come to afterwards. And then how do we achieve that? We typically have, a daily work of rolling out campaigns, rolling out communication, rolling out PR, working with key opinion leaders, and so on. But I think the key of CX is also, and as I said, taking a step back, which leads to more experimentation, more iterative, agile ways of working, moving towards not having a campaign, but having a customer experience. What I mean by that is that now, at least, we tend to make a campaign, maybe hire an agency, do a campaign, afterwards analyze the campaign, campaign done, let's move to the next one. But I think here it's much more important to have something which we learn in iteration. So we do something, we learn, and we continue from it. And the rest you can read yourself. But if I may quickly deep dive into the experimentation, and here also we worked with Cap2 in early days when I was still a digital lead in MSD Switzerland, where we looked at through setting a hypothesis, which initially actually was wrong, thinking oncologists want to have a certain type of information about their patient, going through a design thinking approach with emphasizing really like mapping things out, defining, ideating about what could be first the problem and then the solution, and then prototyping and testing it with real customers. And sometimes that will result in seeing that the hypothesis you set failed in the test because it was not the challenge people looked for a solution for. And in the case of Oncology Compass, that was very much so. But through design thinking, we went through that in a speedy fashion, and very quickly were in a circle back at empathizing, defining, ideating, and prototyping of something that the oncologist in that case wanted to have a real solution for, which is a summarizing service for studies, for practice relevant and practice changing studies. So a very good example here of starting from a white paper and going through several iterations to come up with a real value, which then hopefully for us results in real business. Another way I mentioned it is the agile way of working. So I think here it's very critical that you don't go for the buzzwords. Is it agile? Is it Scrum? Is it Kanban? Forget that a bit. I show you here one concept. It's also a buzzword, dual track agile, but you can also erase that. But what is really key is that you have your daily work, your backlogs, your releases, you work in iterations, you deliver new campaigns, you deliver new emails, you deliver new communication and new insights to the doctors. But in parallel, always keep a bit of time for your experiments, which then inform the daily work, right? So I think it's key that what we do in CX in terms of innovation, in terms of new approaches, is not absolutely separate from our daily work. Because otherwise it's kind of the I'm busy syndrome, right? I'm working all day and then I have to do this innovation project, which I'm not really keen on because I have to do it on Saturday. So I think when you Google dual track agile or similar methods, you will get some insights on how you can merge those two worlds a bit further. And back to omnichannel, right? As we said, always on campaigns, because it is key that you don't have an email and then you have something completely else in your webinar. Try to design your journeys, map your journeys, try to use what you see here on the left, a kind of iterative model where you define, do something, and then you learn, and then you evaluate your learnings, and then you execute again. Seems very obvious, but I think that took, at least in my career in pharma, several years to get there, especially on a regional level, so that you move kind of from a multi-channel, which is sending a lot of emails, making a lot of websites, landing pages, putting things on social media for things that the public can see and so on, towards a more unified approach, which might even include market access, which might even include your medical colleagues, and which might, of course, include the public as well, so HCCs and HCPs as well. So the next thing I would like to talk about, which enables CX and omnichannel, is taking a step back from being busy. Taking a step back where, of course, and you see it on the left side, we need outputs, right? We need to do tasks, we need to have things done, but only that should be done if it generates some kind of an outcome. And by now you're experts. You know that outcomes should solve a problem, should show an innovation, should trigger a certain customer behavior or adoption, should trigger maybe on the patient side some awareness, and so on. So really something that generates outcome. If 100 doctors would tell us, this is a great material, can you send me more? And we just spend an hour doing it, we would be happy, right? On the other side, if we would spend thousands of hours for a campaign and nobody ever gave us feedback that this is of value, then we might feel, why are we doing it? And this is the difference between output, outcome, and eventually, of course, impact on our bottom line, right? We are still, most of us at least, for-profit companies, so we do have to eventually make a profit. And now I'll move a bit faster, because this topic here is something we could even deep dive more, data. So starting from making sure all our assets are properly tagged, properly stored in some kind of a system, are reused, translated, are not redone in a slightly different way with a waste of time. So starting from that, from the asset perspective, towards what we said, and I come to that in the next slide, where do we measure things? But the vast majority of data, the vast volume, actually, I want to say, of data, is a critical element for us to take the right decisions. But data is nothing without insights, right? So if you have a lot of data, but you cannot generate any knowledge out of it, any insights, then that's a miss. That's just data garbage, right? So I think with the intuition of our experiences, we can read out of data, and then these two things together actually help us to create informed decisions. And we move here to the next part of the now KPI. So as you see here, right, we started at CX on a very broad level, and omnichannel. Now we narrowing down. So how do you approach it? How do you split it up? What is important? How do you work? And now it's actually how do we measure, right? That's, I think, a critical aspect of our talk today. How do we measure? And of course, on the strategic opportunity side, you have what I explained, the jobs to be done. You have some design thinking outcomes. You have the Google OKR framework and other frameworks from large universities and other businesses, right? So, and you saw that slide, and now I'm moving from, splitting things up in a journey to how do we measure, right? So on the strategic side, you measure in a strategic way. On the customer engagement side, which shows you how well from the strategy have we now started to execute, right? How is the tactics? So you see that in the data analytics, in some kind of a data dashboards, in campaign matrix. Obviously, here you have the clicks, the call to actions, cost per click, all those very technical, tangible, numeric metrics, right? Here it's very factual. Is a click or there's no click? There's no half click, right? So, but out of this, you then need to translate into customer value. And here, there is also several that you can measure. And of course, we'll deep dive into the NPS and CSAT. but you have others, right? You have retention rate, you have effort scores, you have churn rates. And here again, I'm sure that by taking the slide, Googling a bit more in detail and taking your experiences, you will come up with a good high level measures and then deep dive into actual matrix that you can measure that will give you the information. And then, of course, the challenge is then through data out of your CRM, out of your financial forecasts versus outcomes, you can then start to calculate your effectiveness of the activities that you are doing to finally understand, did I do the right strategy? Did I do the right tactics? Did those tactics actually result in customer value because the customer tells it to me? And did that customer value actually bring me some kind of benefit, right? Because we, in pharma and any other industries, I'm sure if we bring a bottle of wine to every doctor that drinks wine, that would bring value, besides that this is not legal. But it does not bring us business value in return, right? So first of all, we have to be compliant. We have to do what is possible to do. We cannot deliver wine, right? That's not compliant. And second, we have to do what is in our remit, insights generation, to then generate business value. So as an example, I think this gives you a good high level input there. So I move on now again, as you see in my funnel, deep diving a bit more into what is CSAT and NPS, and again setting the scene so that we all understand what it means, because it's both kind of, could be Smiley's numbers, could be kind of a rating, right? 0 to 10 on NPS side, 1 to 5 or 1 to 4, 1 to 3, depending on your CSAT setup and belief system. It's also like a number, choosing a number from bad to good, right? So I think it's very critical to understand the differences. So on the NPS rates how well a customer or a person coming in touch with you would recommend you to peers, family, and so on. It is very critical that, and you see it, it is 0 to 10. It's not 1 to 8 or 6 to 10 or 2 to 1, whatever. It is 0 to 10. It is a standardized calculation, and it is a standardized matrix that comes out of it. And only if you do it in that proper way, you can, if you're in my shoes where you support multiple countries or a region, you can compare, but you can also benchmark. So I'll give you an example here, because I think these are now the topics where we should deep dive a bit. So in NPS, if you measure an NPS in Switzerland and in Austria, or let's take bigger differences in Switzerland and Portugal, the context is completely different. You might have bigger business in Portugal, smaller in Switzerland, or the other way around. You might have different target audiences because the therapeutic area is split different. You might have a different internal structure, and you might have different agencies that support you with content. So how dare you to say, we have an NPS in Portugal and an NPS in Switzerland, comparing them. Completely different context, right? So what you should do much rather is to say, all right, let's set the benchmark. Let's set the NPS benchmark and then see how we progress 3-6 months down the line, right? More market research type of approach. And then maybe splitting down, we said we want to understand the customer a bit beyond the obvious, splitting things up, saying, okay, maybe we have the same email campaign that we run in both countries, very similar. So maybe if we do a market research and we take NPS through this channel, we could compare or find some learnings out of this, right? But be careful to not kind of make an NPS and then just, compare everything, especially if you work with multiple therapeutic areas, multiple countries, or multiple business units. On the side of CSAT, that's more, let's call it tactical. So you send an email, you ask, did you like the content? Yes, no, or 1 to 10. You can ask follow-up questions and so on, right? And here it's very important that, again, you know where you asked, what you asked, and what's your target audience? What's the context of the customer that you're asking. Because again, and this is purely hypothetical, not proven by data, but probably if I go to HCP, I'm standing there, it's hot, and I'm asking, so how would you rate me that I'm coming here, my content I'm showing you? Depending on the character, either the doctor would be, it's okay, thank you very much for your effort. Versus emails where I send the 7th email in one day, the doctor would probably say, not good. Regardless how he might remember actually the content, and we actually got the business value out of her or him, right? So very different things, CSAT and NPS, even though it's a similar technical or similar tactic to ask the question, right? And as I said, and I won't read through the slide, you will get it afterwards, there's other KPIs that you can learn from. When I started, or we started with NPS and CSAT, we never believed that this is the silver bullet, the one thing that will tell us all the insights. It was the starting point. It was the starting point to engage more. It was the starting point to generate a feedback loop. It was a starting point for us to understand how do we work with data. It was a starting point for an omni-channel feedback loop and so on, right? So you can go through this. And now I tell you a bit more about the project itself, where it started with saying, okay, let's have a feedback culture. And you see here with a bit of a smile, let's put it on our roadmap. We want to have a feedback loop, right? And then there was different voices. There was voices, yeah, but we have a Salesforce, they are asking feedback. Or there was voice, yeah, but we're sending emails, we see it by the clicks, and so on. So it was really a transformational project. It is a transformational project, especially when you're dealing with multiple teams, multiple products, multiple different contexts, like country context, therapeutic area context, HCP context, right? An oncologist has a complete different profile than a general practitioner, right? Also merging in eventually the patients, maybe even the payers, maybe even some other data sources. So it very quickly, out of those two questions, right, it became quite a big challenge that we were looking to solve. And if we deep dive now again a bit into what then was established as a voice of the customer program, which we did, and I guess that's why I'm here invited to the Screver talk here, to the webinar, as we did partner with Screver and Cap2 on this. We very quickly saw this is not the tool that you implement. This is much more. This is a transformation project. This is a training project. This is actual talking in a different way to customer project. So we engaged very deeply in this collaboration because it actually impacted our strategy. And without, let's say, sharing details, I can tell you that this included workshops and putting things into strategy. Like, we need to understand our customer, and then from what you now saw from me, in a level of, okay, what is the actual number? Where do we get it from which system that we can display on a screen and say 3 is good, 4 is better, and making sure people look at this number, right? It was also a whole program. So even though it seems simple, we had to integrate this seamlessly into all our channels, right? So you don't want an ugly pop-up coming to ask you a question, because then obviously your participation rate is much, much lower, right? You want to have it needless and seamlessly integrated in a nice way, so that you also can learn, not compare, learn on what works and what doesn't, and where are people more responsive to feedback, where they are not, in which way they're giving feedback. Even up until the point where you can ask text questions, right? Which, of course, thanks to Screver, was perfectly monitored, because here you have the adverse events, where if you are reported an adverse event through a tool like a survey, you have to immediately react, right? So there needs to be some triggers as well that works. And then eventually, the key as well, a key aspect is all this data needs to arrive somewhere where it is used to generate insights. So what does that mean? If you're using Excel, then you need it in Excel. Of course, we have data warehouse solutions and some other things. It's like Click or Tableau or BI solutions. I'm sure we all have it that we use, but the data needs to be there, because otherwise you will force people to go on some tools and software and look at data, and they might not do it, and then the insight is lost. So the whole process of looking at a certain dashboard in Screver itself for tactical reasons and having this data aggregated across more, let's say, business data that we have to take some decisions, and making it targeted for the audience that it's required. So one for the campaign manager, one for the manager, for the business unit director. That was a whole element of this, or is a whole element of this project, which I'm sure you're also facing in other pharma. So definitely important. And then also now we did the questions. We know what is CX. We know what is omnichannel. We communicate through an omnichannel. In the channels, we ask for feedback. And now what happens? So this feedback should then, and you see it here, rapidly become an innovation driver, right? So with this feedback, you should very quickly be able to translate it into an updated campaign, updated content, an action that you need to do either internally or towards external, and so on, right? So this really became quite transformative into co-creation. And before I continue, I'll just see the chat. I know we'll have a Q&A afterwards, but I'm flexible here, so I'm reading out the question here of Ludovico. So many consider the NPS as a vanity metric. What do you think about it? Which is your North Star metric? Thanks. So thanks for the question. So indeed, right? And I made the disclaimer, luckily I did it, that the NPS is not the silver bullet. So, and the NPS is only as valuable if you understand the context in which you ask the NPS. So again, if you send one NPS survey in a kind of market research, you don't gather like the background of the data, and then you see, I don't know, 33 versus 66% or whatever in different countries or business units. I wouldn't trust that too much, right? Without knowing the context, it really is just kind of not a leading metric, but like looking backward metric, and much more on the vanity metric side, right? So I think we can further deep dive, but the North Star is my dashboard. Is I log into Screver, I see the feedback, I read feedback, I can combine my engagement matrix with NPS. I see how the NPS is growing. So it's a whole program of me looking at data, which is my North Star, because otherwise I can be very quickly, made believe that this is something which is not true. So reading data, generating data is much more complex than just looking at one metric, let's say. So I hope I gave you, it's by the way, a very great question and very difficult. So I hope I did give you some insights into that. So if we move on.
We have another question, but maybe we should put it Q&A later so you can continue with...
Yeah, sure. I think now you heard a lot of things, right? And now I would like to know from you, from the people that are there, are you measuring NPS and CSAT particularly? I would be very curious to hear that. So it's a bit half-half. So we have some answers yes, some answers no. I think for me is key, again, coming back to the vanity metric, right? Which really means we are measuring some clicks or whatever, but we don't really know the return on investment. When we think about the earlier slide I had, this proxy, I call it a proxy, between a click and the value is only, you will only be able to know that more like in at least an estimated hypothesis way when you split it up in small pieces with the right context. So again, if you do a campaign and at least you can say, you know what, people in email rather give us low ratings versus CLM's presentation, whatever, higher ratings. So at least you can calculate your return on investment by weighing in the CLM or face-to-face part higher than the email part, right? So you kind of create a score maybe for your interactions, which will help you more relate those two. So, all right, and actually now we have exactly a split between the answers. So again, I think the key here, and also why we have chosen Screver, is not necessarily to just have the two questions, is to engage on a journey of a feedback loop. Engage on a journey where you much more move into, let's say, a real-time feedback analysis, and a strategic one, of course, but where you can kind of use that tool as a daily tactical tool to learn more about your customers. Same with the integration of the data, which I referred to quite long, and some kind of automation, because again, we are pharma, so we need some way of automating adverse events, sending certain answers to certain group of people, having a certain algorithm which correlates different question types, helping with setting up surveys more quick, so that, you know, through this way of using AI in Screver, you could very quickly have new surveys, right? So once you have your NPS back, you should deep dive, right? And maybe you have which we did, you have a focus group, a group of doctors which you contract, and you are able to ask more detailed questions. So very quickly, you could ask, if you see the benchmark falling of NPS, how do we move that, and so on, right? We need to take care of data, GDPR, and even, you see it here, we could do some quizzes, which also were part of some campaigns, and all eventually is in one data source. I tell you, this is critical. You know, it's certainly, you have so many tools. If you need to log into all of them, that's a pain. Good. This is just quick. As you see here, I think I made it clear. When you take care first of a certain one product, one therapeutic area, one stakeholder group, one team, that's one level of feedback loop. The other one is if you have multiple feedbacks. And I tell you one critical thing I thought, will we have enough feedbacks to have, let's say, statistical relevant data? I wasn't sure about that when we started, but as you see here, we did. So, and this data already progressed. So, but what we can share is this. So we did quite some integrations, quite some feedbacks, which generated on turn quite some insights. And again, and you see it here, this is a whole program. So I explained you the CSAT, the customer satisfaction score. I explained you the NPS. And while, and very correctly, it's sometimes a vanity metric, sometimes with the context, it becomes much more relevant to translate it into real investment, return on investment or business value. The next step is to have it as a benchmark, to also have, let's say, a regional, global, whatever is your structure, benchmark survey, ideally with other pharmas as well, which we are also working on, so that you can start to benchmark, because you not necessarily care if compared to MSD, AstraZeneca has a higher NPS. You care about your business outcome and what do you need to do, what you need to scale to then pass your competitor, right? So beyond the vanity metric part. So I think this is critical, that you have some kind of benchmark and that you have the details, that you know something when a score, NPS or CSAT, went up or down, you can relate it back to why, or at least some hypothesis. So this is very critical, that this is a whole program which is will be extended. But again, as we're sharing in the wider range, this is as far as we can share. But definitely we have a plan going forward, having other matrix, better combination, better correlation, better data analysis, better data science, and better data quality. So all this is on our roadmap. And I think I'm coming to the end, so that we have time for Q&A. And I would like to tell you on the top use cases. So, and here we will be now a bit repetitive. So we went through all the funnel. Now you know why it is NPS and CSAT as part of CX, as part of Omnichannel, all the campaigns. And the best use cases that I can share is one, and you will now learn a bit about the Omnichannel without too much detail, is of course email and web pages, right? Email, downloads, UX, UI, a lot of things to learn. A website is not a website. A survey on a website is not a survey on a website. UX can make a huge difference. Subject lines can make a huge difference, and many other things which I cannot share that make a difference, right? So you see that on the left part. Webinars as well, as this one, right? We will also ask you feedback. How did that help? Then on the right side, the NPS email campaign. So again, more market research approach. So it's not a proper, like a full market research cycle, but more in, okay, let's take the month of January. Let's ask through all the channels the NPS question. Then let's take February to revise it, deep dive it, and then follow up. And finally, the website feedback, again, very critical. And I mentioned here the quizzes again, which can generate a lot of interaction and feedback loop while people are entertained. So a bit of a gamification element. You can look at the survey, I think, but I'll come back to that slide in a second. And you can click it. But yeah, before we go to the Q&A, this is my last slide. I'll just give you a snippet of fun going home before the Q&A. And we do some workshops, right? You certainly all do. And one of the exercises we do, which I find quite fun, is role playing internally inside you, because we are from Pharma. We have a background in some of us in research and science. So I encourage you to sometimes think, what would Elon Musk do? What would Jeff Bezos do? I actually think, what would my father do, who's a small entrepreneur himself, and one of my role models. So think of a person, put yourself in their shoes and think what they would do, because that then removes the risk, because you know, even for yourself, it's Elon Musk, right? It's the crazy guy that wants to buy McDonald's and fix all the ice cream machines or build another rocket ship. So, and with that, I think, Wojtek, we can move to the Q&A. You will get those slides, so you can Google all those exercises, the frameworks, and with that, yeah, let's go into the questions.
So I first of all have to thank you for this incredible performance and this very interesting narrative that you have produced. As we were talking about fighting in the beginning, I think you not only won by points and technicality, but it's a full knockout as it comes to knowledge. So thank you very much for that. So the champion's belt goes for sure to you for now. And I would like to start with a question that's been in the pipeline already for a bit. It's the question from Bruno. And the question is, if your NPS goes from 10 to 15 in 6 months, would your conclusion be that you did a good job? If so, then how do you know which initiatives were good and which ones were bad? You would need to do a proper A/B testing, which personally I've never seen systematically applied in pharma.
Good question. Very complicated one. I'm sweating, not from the heat. So basically, and it's a bit of my repetition. So first of all, at least you need to know which feedback came from where. That's your basic, right? You need to know it came from an email or from actual email, from the first email, from the second, from the third, right? So even without A/B testing, you need to have as much context as you can for the NPS, because maybe it was that I don't know. I'm just making an extreme. You had a technical issue, and somebody clicked seven times per person, and you suddenly improved some basis points. So context is key. Don't think that improving, and it's not only NPS. It's any metric like clicks, or I give you the other example. Is more visitors on your website or a longer duration of your visitors on the website good? In the past, clear answer was yes. But maybe it's because they don't find the bloody information on your website and just have to click around, and it's really important, so they stay and then actually do it, right? So the context is king, and the way to know if you did a good job is, again, work as well with hypothesis and do the work. So let's say we have this example. It raised 5 basis points in 6 months. I have to go in and look at the data, look at the team, discuss it, even if it's just like intuition, and then analyze what we have done differently. Maybe it's another example, that the product was out of stock and now it's in stock. People like that because they wanted the product. It's a health product, so maybe they needed it. So you have to understand, because if it's the case of the product out of stock, you would not say we have done a good job. You would say, well, we have done a good job for putting a product back in stock, but our campaign communication not necessarily improved. Hence, let's not tap too much on our shoulders. Of course, let's do a good promotion with our manager, but then afterwards go back to work. I hope that answers a bit. It's a very difficult question. And just maybe to add, A/B testing, start small. I mean, we have done some. But I see as well, this is a very siloed approach. So we don't do A/B as a strategy, like everywhere, proper A/B, as you say, systematically everywhere, because A/B also means A cost, B cost, right? So sometimes you cannot do it. So I think I would do A/B testing sporadically, not, let's say, systematically, or systematically sporadically, if you wish. So I hope that answers.
So I will once again encourage everybody who's been listening and is listening to write the questions down here in the chat or in the question interface. And while we are waiting for you, I would like to ask Michal at least 1 or 2 more questions that already came in. So sure. You also can vote on the questions in the point of their importance. If you see the little black arrow next to the question, you can actually move it up and you can decide which question would interest you more from the audience. So here is the next question. How does the omnichannel approach influence the content strategy, especially regarding consistency and customization across various channels?
Right. And we, of course, based on the topic of this webinar, we're much more into the feedback loop. The omnichannel we kind of drove through, and I think in the omnichannel, the content strategy, and I think we are all big pharmas at least moving in that way. We should reduce waste, right? So we should have some kind of a global approach or ideation, and then see where do we really need adjustments? Like, are we really all so different in a certain therapeutic area and in a certain target audience? But I think here it is key to understand that's the first, right? Because with that, you can much more than focus on the channel related topics. So obviously, you don't want to send the same on Twitter, which is as a reduced text only, an images and video characters, right? So it's a rather short format versus Instagram, which you just make videos, right? Versus a website and the blog. So obviously, when you start omni-channel, you need to define your channels, and then you need to think, how does that orchestrate in terms of content, but also in terms of journey, right? You saw it. There's a journey which you map at the beginning, and you need to understand which touch point has which content. So it's not only channel, it's also where is it in the journey of the customer. Like if he receives the 7th email from you, it should not be the same content as in the first, right? So absolutely, omnichannel is orchestrating the content, not only sending the same content through multiple channels. I hope that answers as well.
That does very well. And here's one more question that pertains to your team organization. How is your team organized? What aspects do you handle internally and which ones externally?
Yeah, and here, of course, I mean, again, that's why I'm invited. We have collaborated greatly with Screver and Cap2. And as you all learn now, I'm responsible for a regional setup. And without kind of giving away any details or business insights, I think it is key that your team as a whole can cover the feedback loop and has the authority to cover the feedback loop. And I give you one example, which was a key transformation. It is sales and marketing, because in many pharma, sales and marketing is complete different structure, different reporting lines, different everything. And to find a way where, even it is not my team, I can collaborate well through maybe one tool, through one approach, through one database, through whatever, to have a feedback loop. That would be one example. And then it is the same about, campaigns. And here, again, we could discuss for another hour. In your campaign structure, think of it that you create an always on approach, moving away from I hire an agency, I want them to do a campaign, because then the agency, sorry for any agency members here, they see money, right? So they will do a campaign, they will tick it off and done. But if you do always on, you can start to venture into shared risks. You can venture into saying, hey, we are one team, the campaign didn't work, how do we do it better? And so on. So I think that is key about your team organization, without sharing any business detail, that it is a coherent team with authority and the right tools to get the full feedback loop done.
So we have 2 more questions, and I think they kind of build up on each other or are related. The first one is about the challenges. Could you shed some light on the significant challenges of your company and how you navigated while transitioning from multi-channel to omni-channel?
Right. So again, without sharing any critical information, I think the key is to understand the orchestration element, the content element, and the value element. So moving away from just creating like outputs, like I want to send 7 emails, and if I have 7 campaigns done with 7 agencies, I will get props from my manager, towards an output value-based approach where you say, okay, I don't know for sure, but I think if we do this, that might result into that. And with iterations, build that knowledge. So again, multi-channel is a good first step. Don't get me wrong. Starting beyond investing, I don't know, just in pure websites, but into how we get traffic on the website is definitely the right approach. But very quickly, take a small subset and try to orchestrate it around one value chain, one customer journey, one touch point map, whatever it is. So yeah, that's.
Thank you. And following that question, there's fantastic. I can see that everybody's very much interested and up on your explanations. So there's 2 more questions that I would like to ask. So one is about a possible link to some HC industry data for digital engagement that will show us an indicative of a good performance. That maybe is a question there is a warm-up for the next question, which would be, following that up, if you could recommend any online communities, newsletters, Substack publications who focus on customer experience and digital marketing in the pharma industry.
So I'll ask the second one first. It's a bit easier. I think what definitely, and the people that know me, they know, is LinkedIn. So on LinkedIn, it's not about newsletters, but if you follow the right people, which I can definitely share, or you just reach out to me on LinkedIn, I get a lot. And then I deep dive, right? I see studies, I see inputs, I see real life learnings from other experts. So that definitely helps me. And when I have time, I Google and deep dive, because my answer is like this, because CX, as I said before, is very broad. So which part of CX? Is it data? There is great data communities. There is data learning on platforms that I forgot the name, but all those learning platforms. You can get certainly a lot of small courses where you learn about data. Is it campaign? More marketing, more creative, more UX, UI, which is as well my background. There is other groups, other websites. I don't recall all of them, but if you reach out to me on LinkedIn, definitely I can give you some examples. So Google, LinkedIn, and your peers in CX, but CX is too wide to tell you this is the newsletter you need to get signed up to. And then the second question, it's also a good question. So we work with several suppliers, but basically through Screver, we try to correlate all this data, right, and all this KPIs. So we don't have publicly available data. We built this database ourselves, right? So I think publicly, but of course paid, platforms like IQVIA, statistic platforms that you might use. But then you need to, because again, data is one, but then you need to build context around the data. So honestly, this is a question I have to answer. I don't know. To have some HC industry data, one platform I go where it is publicly available for KPIs. I had to build that in the region myself together with Screver and Cap2. The only thing I can tell, there is NPS and other market research, right? Typical market research, which you could refer to, but not like industry data, which I would know. Sorry.
Sorry, not sorry. No, but thank you very much for this answer. I think we have one more question that we have not talked about, is the influence of the omnichannel approach on the content strategy. Can you tell us something about the consistency and customization across various channels?
The content. So didn't we answer the content strategy, or was that a different question? But yeah, let me, if I summarize, so this is the, let me see, omnichannel. How does the omnichannel approach influence the content strategy? Is this one? Just so
yes, exactly this one, yes.
Yeah, okay. Especially regarding consistency and customization across various channels. Okay, all great questions. I'm really sweating now. So the omnichannel approach is, how can I say? It's about orchestrating the channels and the content. What you need to have concise is your story. So everything starts with a story, right? You need to tell your story right, which is told differently on different channels and customized maybe to target audiences or I don't know, local needs, or personalized in visual aspects. Some people like more statistical, like Excel type look, some like bar charts, some like videos. So, but the story is the first. So omnichannel forces you to first think of the story, to not think I do an email, I do a website, but think about the story you want to convey, the eventual value this story conveys, because we are in communications, right? And then only think about how you split it across the channel and how is the format, which is the right format in which channel, right? So I think in summary, that is what I would answer this question. Think of your story first. Omnichannel forces you to think of the story first, and then think with a consistent, concise story for how to personalize and customize it for the channel and the elements to tell. Yeah.
Thank you very much. Do we have any more questions? I think most of us are also processing your information, so it always takes some time before the questions pop up. Any more questions? Wonderful. I believe we have covered a very wide and broad field of information. And thank you very much, Michal Myszkowski, for that. Thank you very much for lifting a veil on the omnichannel strategy and how it's being used in the CX in pharma. So we are really glad you have visited us and you were able to talk to us about this thing. For our guests, we do have here a QR code that you can use. And of course, we will send out the slide deck to you if you would like to have it. And we also will have a recording of this session, so it's possible to re-watch it and re-listen and deepen and deep dive into the themes that Michal has been discussing. So if there is no more questions, I think I would say thank you very much for being with us. Thank you very much for listening. Stay tuned with us. We will have more webinars coming up with more fascinating themes and presenters who will be visiting us and speaking on their themes, on their passions, and on their content. Again, thank you very much, and goodbye.
Thank you very much, everybody.